I look at cells as little humans. When I walk into a bar, if I like that environment, I'm thriving. I'm feeling good. If I don't like the environment, I'll start freaking out. Our cells are the same way.
We can reverse hair loss if we catch it early enough. When I catch somebody in his 20s and he says, I think I'm losing my hair, I have a way of knowing if he's losing his hair.
How do we give the body less collagen and more of the other good stuff that it could use to heal? And we were doing our FDA clearance, we have to prove that.
So, today we're with Danielle Fette from Fette Tech. And Danielle is the CEO and co-founder of ReyaGel. So, tell us a little bit about ReyaGel.
ReyaGel is the newest thing out in aesthetics. It's the first and only liquid extracellular matrix. And we are so excited about this product because we're watching it create miracles in the hospital to heal patients' wounds. And now we're launching into areas like hair restoration. And you are the first to use it.
Yeah, well, thanks.
Yeah.
Yes. And I do appreciate that. We've been studying this product now since May of this year, 2025. So, tell me about this multi-tissue platform that you've developed.
Well,
why did you develop it?
My husband and I met working for a company called A-Cell, and he helped develop a product that you used in hair restoration. And it came from one extracellular matrix. An extracellular matrix, as you know, and probably could explain better than me, is really fascinating in that there's a lot of biomolecules in an extracellular matrix that helps facilitate healing. Mm-hmm. And we realized early on that not all extracellular matrix are created equally. All of our tissues, all of our body is made up of extracellular matrix. And think about the functions of our organs. Like our bladders don't have the same function as the spleen or the lung or the skin. So my husband said, hey, how do we give the body the widest variety of tools that it could use to regenerate even better than other products I've made in the past? Mm-hmm. And the way he discovered to do that is to take more than one tissue, more than one extracellular matrix, do a custom blend, and put it in a product. And we knew the results would be good, but I've been a clinician for over 20 years. And when we first saw it used in the hospital, I came home crying because we were able to heal patients that I never thought we'd ever be able to heal. But we wanted to take it one step further, because if our technology recognizes injury in the body and then signals for the body to heal, we knew if we could turn this powder into a liquid, what else could we do with this technology and how much faster would it work? Because when you have these particles, you're waiting for them to break down into the body before they work. In liquid form, could we make it work even faster? And the answer is yes. We have clinical evidence that shows liquid versions of our powder works faster. So that's where we're at today with ReyaGel. It's the first product of its kind in a liquid form.
Right. It's very exciting. Now, so you started with lung and spleen, right? Mm-hmm. Tell me why you chose lung and spleen. And this is porcine derived, so it's pig derived. Mm-hmm. Why did you choose lung and spleen?
My husband's an engineer, and luckily he's a genius. He analyzed every single extracellular matrix, right, and he's very curious. And most extracellular matrix are 90% collagen, mm-hmm, and only 10% of the other good stuff your body needs to regenerate. Collagen's more structural component, but when we're talking about like hair restoration or nerve regeneration, we really need the tools and instructions to help the body regrow hair or help nerves regenerate. So the idea was, how do we give the body less collagen and more of the other good stuff that it could use to heal? When he found the spleen in the lung, we celebrated all night long. He was so excited. He's like, there's so much different than all the other organs, all the other extracellular matrix. They're only 45% collagen and more of all the other good stuff the body could use, like all the various growth factors. I mean, there's over 500 peptides in our product. So we have the widest variety of biomolecules, but we also have high concentrations of them all, which is why we believe our material is so effective in the body.
That's amazing, really. So When you look at, you have like type 1, type 3, type 4, type 5 collagen, but you also have the other good stuff like the elastin, laminin,
Right.
glycosaminoglycans, exosomes, peptides. You've kind of got it all.
Correct. And, when we take the tissue structure, basically cells live in extracellular matrix. And when you remove the cells and we give the body all this other good stuff, it doesn't recognize it as foreign. So there's no potential harm. Like we're not putting anything that's recognized as foreign into the body, but we're putting all this good stuff at the injury site. So what it's doing is it's signaling to the body and saying, hey, you know what? There's an injury here, or there's a deficit. Let's tell the body to heal differently and repair what is damaged. So even like me as a consumer, I've used it on my skin after microneedling, and we lose collagen as we age. My skin right here is starting to get saggy. I don't want a facelift. So I'm continuing to like microneedle and work with it to try to use ReyaGel, thicken my wall of my neck and see what outcomes in it. I've loved it as a consumer.
Mm-hmm. That's interesting. I sat down with a group of plastic surgeons recently in San Diego, and I made a comment that we can reverse hair loss if we catch it early enough. And so you want to catch it before it's visible. Once it's visible, you kind of already start to lose the battle. And so when I catch somebody in his 20s and he says, I think I'm losing my hair, I have a way of knowing if he's losing his hair. I can evaluate it and I can tell him, yeah, you're losing your hair. In fact, you're going to be horseshoe shaped. So we got to start treatment now. Mm-hmm. And when I do that early, I can reverse it, 100% reverse it. And so I asked these plastic surgeons, is there a way that we can eliminate the need for a facelift if you start early enough? Mm-hmm. And their mindset currently is no. All we can do is make our facelifts better by, let's say, adding adipose stem cells. But what you're talking about is reversing the aging process. But not only that, if people start early enough with their skin, something that actually works, not these cosmetics that you buy from L'Oreal and all these other places that, you think you're doing something great for your skin. Mm-hmm. Water is probably the most important ingredient, right? So, you got this impermeable membrane here called epidermis. You got to get stuff in there. All right. So talking about ReyaGel now, you have all this good stuff that essentially, first of all, for wounds, has everything you need to initiate the healing process. Mm-hmm. So you've got proliferation base, you've got all these growth factors that are going to come in, they're going to stimulate new cells, you're going to be chemoattractants. You've got, all the base to create proliferation of tissue and then to promote the remodeling of tissue. Mm-hmm. So you've dealt with burns, you've dealt with open wounds from Mohs surgery, and you've put full-strength ReyaGel in these. And tell me about the results.
Clinically, I have witnessed patients heal like I've never thought was possible. Really hard, with poor vascularization. Mm. And for the audience, if patients have poor blood flow, it's really hard to heal a wound. And we have used the ReyaGel, and not only has it healed and completely filled in the deficit also. So think about this. In trauma, if I'm in an accident and I volumetric tissue loss where a chunk of my body's on the side of the road, if I heal it, typically you're hoping to get scar tissue form across, but you have a concave area. But we're watching, after using our technology, that deficit completely fill in, and then the skin's epithelializing over, which means you're getting soft, supple skin and not scar tissue is what I'm seeing. I've seen burn patients that have healed and then their hair follicles regrow. I mean, that's nothing short of a miracle. So when I've seen clinically, hundreds of thousands of patients heal, never one adverse reaction, it just gives me so much hope to the future as to what we can do with this product. Mm. And in hair restoration, we saw when I worked at ACell how well that product worked. knowing clinically what I'm seeing in the hospital, I can't wait to see how this in liquid version and more advanced product, how that's going to translate to help your patients.
Right. So ACell was really an interesting product that I followed for a while. And then initially we had it in veterinary medicine. Mm-hmm. So we had horses, and horses are stupid. And, they will cut themselves.
I must be stupid too. I cut myself.
and so you have these terrible wounds. And so I said, okay, I'll put some ACell in there. And it worked really well. And they would, heal over with hair. And so then it finally hit the FDA. And so I started to add it in PRP. And we actually had a better response in our PRP patients when we added ACell. And now I think it's like everywhere. Everybody's putting it in PRP today. But the problem is it's a solid. Mm-hmm. And, so it's like you say, you got to first liquefy it. Mm-hmm. So your body has to sort of digest it a little and then turn it into this extracellular matrix that starts telling the cells, rebuild what used to be here. Right. And that's what's really cool. I mean, I've got a wound on my leg I treated with ACell, and it completely reepithelialized. It was fantastic. And then also I've used it in my donor areas to get improved healing and follicle regeneration. I mean, it will go because we leave stem cells behind when we perform a limited depth FUE procedure. So I've been putting it in extraction sites now since 2008. And we found early on that we couldn't locate 48% of the extraction sites. And then we did a more limited area where we could actually see the hairs regrow in the extraction sites, at least one hair in 58% of the extraction sites when we sealed it in. And the problem is it tends to leak out. Mm-hmm. And so one of the things I'm really excited about this ReyaGel is the liquid form, which I can apply either directly on the donor area, or I can add it in with a PRF and apply that with, PRF is going to, when I add thrombin, it's going to activate platelets. So I'm going to get more growth factors, which you've already got growth factors, but they're going to be bioidentical growth factors. And we also get a certain amount of collagen synthesis that will seal the wound and help keep everything there. Mm-hmm. So it's sort of like a biodegradable wound dressing that goes away and seals everything in. But I may not even need to use the PRF with this product. It's a really exciting product. So, okay, when you first came out with ReyaGel, it was in a powder form. Is that right?
Yeah, the first was, we call it Excellistem Wound Powder by Stemsys. Mm-hmm. So as a company, FetTech's our main parent company, and then we have other companies underneath it. Like we have an antiviral company called Viramed. Stemsys has our wound powder, and now ReyaGel is the liquid version. And if you think about this, I think you'll appreciate someone of your caliber. I didn't want to bother you in 2018 when we got our wound powder indication. I could have knocked on your door and said, hey, I think there's a more advanced product of ACell. This is our wound powder. This is why I think it's more advanced. I want you to try it. But clinically, the reason why I didn't approach you is because I have mad respect for you as a pioneer. And I know that there's a period of time we're waiting before, in particulate form, in powder form, you're waiting for it to break down. And time is of essence with the hair follicle and inflammation. And we need something to work as fast as humanly possible to keep the inflammation low so the hair follicle takes as best as possible. And although long-term in wound clinics, I saw how much better our powder performed compared to other products on the market, I wasn't 100% sold that it would be a game changer in hair restoration in powder form. It's another powder product. Is it more advanced? Yes. Does it have less collagen, more of the other good stuff? Yes. But you still have to mix it with all these other products. So I was very strategic waiting till we had liquid version because now I know this is a game changer. This makes everything very different as far as the flexibility and how you can use it. And that's why we're here sitting talking now instead of 2018 when we first got our wound powder FDA cleared.
Got it. 2018, you had the powder. And then I think you got FDA wound care clearance in 2024. Is that right?
Yes, we 2024, but we wanted to collaborate with the pioneers in the aesthetic space, such as yourself. Before, I mean, most companies quickly they get approval, they want to sell. Right. We're a very different company. We're a private company. We don't have outside funding. We don't answer to a board. We always put patients first, and creating the best protocols to get the best outcomes is really the most important thing to us. So although we just started making it available for sale, we have taken this past year after we got our clearance to collaborate with people like yourself to develop those protocols.
Right. So I'll tell you what we're doing. You know, A-cell, for example, is a solid. And I've always felt like, it'd be really great if we could put this in with after we take our grafts out, put it in our holding solution. It gives some sort of stimulatory, regenerative capacity to those grafts. But the problem is it's solid. And you got to, those particles they're like little ground up confetti, little tiny pieces of confetti. And you can't really see them sticking to the graft. So with this liquid, I can dilute it a little with normal saline, sterile saline, and put it in with my holding solution. And it's going right on my grafts. Mm-hmm. And so what I've seen is at least, we only been doing it for a short period of time, but we are seeing some patients. We're not really looking at the data, hard data yet. We're still collecting. But I have seen patients come back in and they're getting faster regrowth. Mm-hmm. Now, whether that'll hold true long term, I don't know. We got to crunch the data, but we are collecting it. We're also doing spot matching in the donor area, where we're labeling the hairs, and we can follow those hairs over time and determine what regrows. We feel like it's going to help with follicles that were damaged during the extraction process, like cut in two. We call it transection. It's kind of like amputation of your leg. Mm-hmm. If you can get both halves of that leg to regrow, pretty good. So if we leave a part of a follicle in the donor area, it's going to help, we think, regenerate it. And we think the part that we accidentally amputate has a greater probability of regrowing when we put it in the recipient area. So it might also improve the survival of certain hair follicles, especially body hair sources like beard hair and also head hair. It might improve the results of high density grafting when we apply it to the grafts. And so the other thing we're looking at is we dilute it, and then we put a cannula on a syringe and inject it into our recipient area. So that's treating not only the grafts that we're putting in there, but also the existing hair. So it's giving that hair sort of a push. We think you got growth factors, you got 160 billion exosomes, which, the number you want is about 100 billion to 300 billion. So you're right in that target range. We really like the product for all those reasons. Mm-hmm. And we couldn't get that with a lot of that with the solid form of an extracellular matrix. So I want to talk a little bit about lung and spleen. So, for example, when somebody's an alcoholic, right? They drink excessively and they're going to damage their liver. Okay? Mm-hmm. But if you stop drinking before, you cause scar tissue formation, that organ has the ability to completely regenerate itself. But it's 90% collagen. Mm-hmm. What about lung and spleen?
Well, I haven't tried dissecting them and seeing if they'll grow back. But if you think about the properties to cleanse, to purify, there's antiviral properties. And when we were getting our first FDA clearance with our wound powder, mm-hmm. we stumbled across finding out that we have antiviral properties in our technology. Mm-hmm. So we get our product through porcine, which is pig. And for all my animal lovers out there, I am one of the biggest animal lovers. These are organs that would have been thrown away and wasted. I have to disclose this because people will hate on me otherwise. But where you get your bacon and your ham, they usually throw away those organs. And instead of throwing them away, we put them to good use. That's the organs that we use. And when we were doing our FDA clearance, we have to prove that if those pigs are infected with virus, would that or could that transmit to humans? Our safety studies that we have to do are really we have a binder this thick that has to go to the FDA, and we could not complete the viral enveloped virus study. Enveloped viruses are some of the world's most deadliest viruses. COVID, HIV, monkeypox, herpes, shingles, hepatitis, you name it. We could not complete it because what we found is that our material inactivated the virus. We found this out right before COVID broke out. But at the time, I'm not a virus specialist. I'm just a wound care nurse and a trauma nurse. And we Googled, I'm like, oh, herpes and shingles, it's an envelope virus. I'm like, cool, I'll put that on the whiteboard and one day we'll study that for an indication. And for now, if I get a fever blister once a year, I'll dab a little bit of the powder with some hydrogel and put it on there. COVID broke out. My husband's like, do you know what an enveloped virus is? I'm like, yeah, herpes and shingles. He's like, Corona. So since we've done some work with the government to work and explore various studies to see how our material can be used for other viral indications, but it just goes to a testament of how the safety studies that go into getting FDA clearance. We put ourselves as a company at the higher standards to have the best sterility because we have to make sure the product's sterile, and depending on how you choose to do that sterility, you can compromise the integrity of the product. So the reason why our product works so well is we don't cut any corners. Everything we do is to keep the purest, most concentrated product. And when my husband wanted to develop a liquid version, he was looking much bigger than hair restoration and wound care. All the other companies wanted to help a tiny therapeutic area, wound care, hernia, breast. And then they wanted to cash out, sell out to the big companies, and then go on their yachts. Where my husband is a visionary and we care so much about patients. We're like, what can we do with this technology? If this technology recognizes injury and then signals to your body how to heal and remodel, what happens after a heart attack when that heart muscle dies? Could we potentially inject our liquid version and restore the heart? What about if your kid, falls and is in a wheelchair with spinal cord injury? Could we help regenerate those nerves? A lot of times nerves are really tricky because they form scar tissue. So we were doing studies on that. We're currently doing studies to inject bladders to help thicken the bladder wall for bladder incontinence, lung inhalation. Can we reverse this fibrotic tissue that's occurring in the lung that's causing damage post-COVID or with cystic fibrosis? So, it's exciting. The sky's the limit. Right now, it's indicated for topical use. But we did make the syringe sterile and as potent as possible because we knew we wanted to use the same technology and test for other indications, which is, it takes a long time with the FDA to get those indications, but it's so exciting.
Yeah. All right. So let's talk then a little bit about the amount of extracellular matrix in your product compared to, let's say, ACell.
I think it's the same. Extracellular, because my husband made sure that it's pure. They're both pure. There's no fillers, synthetics. But the difference is the components, the extracellular matrix themselves of the spleen and the lung are much different than the bladders, and bladders is what makes up ACell.
Right.
And think about the bladder. If you just think without even knowing science, functions of the bladder versus functions of the spleen and the lung, spleen and lung are really sophisticated organs. They do a lot of stuff for our body. So logically it would make sense that the different biomolecules in those organs are going to be a wider variety, and there's going to be more stuff to be able to make them be antiviral and for them to be able to clean and purify the blood.
Okay.
But they're both 100% pure.
Both pure. And so which one is more powerful?
From my clinical experience, you really can't compare. ReyaGel works faster than any product I've ever seen.
Right.
And the concentrations of the elastin, fibronectin, laminin, growth factors, we have over 500 unique peptides. The truth is there's not one single magic ingredient. There's a lot of companies pimping out like one growth factor or just an exosome or just this or just that. Our bodies are way too genius and complicated. It takes a whole toolbox to signal and instruct your body to heal. So to think that you can only use one or two ingredients and you're going to have true regenerative medicine is just insane.
Yeah, I agree with that. So, for example, in most individuals, when let's say you take adipose and you make stem cells, and let's say you make a nanofat. Well, that nanofat is full of all kinds of ingredients. So it's the entire milieu or the secretome that's initiating the process. It's not just a cell.
Right.
The cell by itself, very few stem cells become engrafted. It's mostly that they initiate a process, and it's that secretome. And that's basically what you have, is that you have this powerful liquid secretome, and it's got when you think about healing, you have, when you get cut, you want to stop the bleeding. And then the next thing is you want to start with the healing process, which will be rebuilding the tissue. But there's really 4 phases to it. And this essentially, with the exception of hemostasis, is it lays the groundwork for all of that. So I see this as being a great additive to stem cell therapy.
Yes.
It's going to lay down the base for those stem cells to initiate the process, along with all that milieu that's in with it. So it's all the ingredients. I agree 100%. It's the ingredients are a blueprint of what you want to create.
Yep.
It's telling that tissue regenerate what's broken.
Yeah, and you have to think about where cells live in the extracellular matrix. And cells thrive in an optimal environment. I look at cells as little humans, right? When I walk into a bar, if I like that environment, I'm thriving. I'm feeling good. If I don't like the environment, I'll start freaking out. Like if the music stinks and the people suck and the drinks aren't good, I want to get out of there. I don't feel comfortable. Our cells are the same way. So if you put them in an environment where they feel comfortable and they have all the love and the support and the resources and just tools and instructions to know this is what I need to do, they're going to thrive. So it would make sense that what you're saying, if you were to put our product around a cell, that it's going to become happier and work better.
Yeah. Yeah. So Ryan Welter, he likes to show this one slide of it's got all the notes on the sheet of a beautiful symphony piece. And so it's putting all those notes together that creates this beautiful piece of music. And that's what the healing process is like.
Yeah.
And so otherwise you just have random notes, and it's not pleasant. It sounds like the worst thing you ever heard. So I got to tell you, I'm holding this bottle here of sterile saline.
Yeah.
I think it's sterile. Anyway, CVS brand. And knowing a little bit about your viral work, because you got a lot of published data.
Yeah.
So we put ReyaGel in there, and I've had this really horrible cold for about 3 days, and I haven't missed work for really since I was 18.
Wow.
And no matter how bad I felt, I went to work, and really didn't feel like working so much this week. But I put the ReyaGel in there, and I squirted it in my nose. I'm already feeling better. And I just did it today. I wish I'd started it sooner.
Well, I can talk about like our herpes and shingles. I know this is a hair conversation, but we have published data on herpes and shingles. And what's pretty interesting is typically if you don't catch it within a certain window, it's too late. There's no therapeutic medication that will help it. And we help the spread of herpes and shingles so quickly. And it can be used, what I love about ReyaGel is it can be used in combination with other therapies or as a standalone. But I get really creative as a wound nurse. I mean, if the wound's infected, I'll mix it with ionic silvers. And typically in the hospital setting, we were taught that if a wound bed is infected, let's treat the infection first, and then we can work on healing the wound, because most wound products would be wasted if you put them in an infected field. But we have successfully treated every infected wound we have touched. We obviously have to give antimicrobials to treat the infection, but we can use them synergistically at the same time. So while we're treating the infection, we're still healing the wound. In fact, I've seen that our material thrives in an infected field. And there's a lot of other products that are considered regenerative that are contraindicated in an infected field.
Yeah, because the bacteria will just eat it and proliferate.
Correct.
Well, it's not antibacterial, but it is antiviral. But that's great. So we're really excited to use this product, and I've been promoting it now to my colleagues as the next big thing.
I have to brag about you for a second, though. There's a lot of people. I'm newer to the aesthetic space. Okay, I'm, like I said, burn, trauma. I'm a hospital-based clinician. As a consumer, I love all things natural and all things beauty. So I know from a consumer using lasers and products with plastic surgeons. However, I have noticed in this industry, there are some behaviors that I don't always agree with. There's a lot of people getting paid under the table to do posts, to do videos like this, to pitch products. And the one thing I really admired about you when we met not only over a Zoom call months ago, but at this last meeting, San Diego Darts in right? In San Diego. Right. You stand up there and you speak based on scientific data and facts. And it is very evident that you're not corrupted or paid to endorse certain products. Mm-hmm. And as a clinician, a consumer, and a co-founder, I have so much respect for that. So I just want to warn consumers to really do your due diligence, be the CEO of your own health, find out the motivations why certain doctors are pimping out certain products and why. Because I think if you dug a little deeper and asked, why are you choosing this product over that? Or there's a lot of stuff that goes on behind the scenes that I'm not proud of in medicine. Yeah. And it's not everyone. There's a lot of great people, but just do your due diligence and know. I can promise you that Dr. Cole speaks on the products that he sees adding value and factually can attest to, which is a beautiful quality that I don't think should go overlooked.
Well, thank you. I think you have to logically assess every product. And sometimes they don't work out. I've had products which physicians have recommended to me, and then I study them, and they don't do anything. Mm-hmm. And so I'm always curious, why did you say this does something?
and for us, I know how great this product is, but now I want to fine tune it. I want to see, how do you find you use it best? How do you dilute it? The next day when a patient comes back, we just did a patient yesterday, and I know the initial thought would be apply more. But you know what? More's not always better. And although would most people want to sell you more product to reapply on that patient, I can still see evidence of ReyaGel on there from yesterday. We could just rehydrate it with a spray and it's on there. We don't need to waste and put more product on top of other product to make it more thick and crusty. That's a waste.
Right.
So I think it will be interesting to see and watch your protocols develop.
Right. Well, we got to do that.
Yeah.
And protocols are important. And I would even say the next phase in all the regenerative therapy is going to be prepping the cells before we treat them, before we harvest them, before we take them out and inject them. You've got to get those cells ready. Mm-hmm. And you do that by starving them, by, you start your exercise, you get plenty of rest, you avoid alcohol and tobacco, and there's certain nutrients that will be beneficial to the cells. So, protocols are just going to get better, and very excited to see what we get with the ReyaGel.
Yeah.
Okay.
Well, thank you, and trusting in our product, and it's exciting.
Yeah. Well, thanks for coming by.